It tells me that the amount of spread there is before the lockdown was unprecedented, very rapid. Number two, many people were falling very sick and they were going to get out of Wuhan for the Chinese New Year festivity. And from there, the spread will be even unprecedented. So what the Chinese government did was correct and it's the right thing to do. It seems very heartless. It seems unimaginable, but it's the right thing to do.
When SARS broke out in 2002, the world was caught unaware by just how lethal the virus was and how fast it could spread. Today, the rapid spread of the 2019 novel coronavirus is just as alarming. Just days after the World Health Organization was alerted to the possible outbreak of a mysterious virus in Wuhan on December 31st, 2019, countries responded by ramping up their internal defenses against the possible spread of the virus. Singapore, for example, implemented thermal screenings at the airports for all travelers coming from Wuhan. It has since banned all Chinese visitors and foreigners with a recent history of travel to China. Today, on almost every continent, countries have taken similar steps of closing their borders to flights and foreign visitors from China as the number of infections outside China grows. There are more than 45,000 confirmed cases of the novel coronavirus in more than 25 other countries and territories.
There are many problems, but one of the chief ones will be the global travel. Because, even if you say, let's not get people coming in from China, but then there are many people who are already affected outside of China. And these people are still traveling everywhere. And so we are still vulnerable. That is actually going to lead to a lot of asymptomatic people around the globe who cannot display symptoms, and then they have the possibility to transmit. Now, how infectious and how transmissible they are, we don't know.
Painful memories of SARS have left a mark on the two Asian cities, Hong Kong and Singapore. They both suffered the biggest brunt of the respiratory illness outside mainland China. There were 299 deaths in Hong Kong and 33 in Singapore. But that painful experience has helped the region deal with the new deadly virus more effectively.
The Hong Kongers were fabulous. The Hong Kongers administrators knew what to do. They were not hesitant in shutting down schools, declaring emergencies, and locking down their individuals. And in Singapore, where I am very, very intimately aware, we have been having annual drills of SARS-like viruses. We have been preparing this for the last 16 years. And enough said, we are now ready for the 2019 novel coronaviruses. You can see books and stacks of protocols that are written, what to do if this happens, what to do if you're not, where to identify areas for quarantine, where should people rest, where do we get extra staff from, what happens if the school were to close, what happens if nobody could work, where do you get this extra manpower? All these questions are answered way before this outbreak.
Dr. Yu Zhijian is the chief physician of the Infectious Diseases Department in Union Hospital in Shenzhen. When he first heard of the mysterious virus, he was taken by surprise.
我们的同事也都在办公室看到微信上面报道武汉发生了新型冠状病毒的这个疫情，大家都觉得非常惊讶。当时只是觉得可能我们又多了一种传染病，没有料到疫情会快速的扩大。
He then set up an emergency response team in the hospital and recruited volunteer colleagues from other departments.
我是专业防控小组里面的成员，我跟医务科的是组织者，因为我们应对这场疫情，那么光靠我们传染科、感染科还有发热门诊单纯的力量是不够的。
Another innovative strategy by Dr. Yu was to set up a telemedicine unit. The idea was to provide critical information to the people who were unsure if they were really ill. as well as to ease the burden of hospital staff due to the escalating number of admissions.
那么另外就是我们也按照现在的这个要求，开展了互联网医院的网上咨询平台。那么通过这个网上咨询，能够更加便捷地服务我们的患者。那么昨天一天的我们网上咨询量就有1600多条。那么这个网上互联网咨询平台的开建，极大地方便了患者的这个咨询，同时有利于消除公众对这个新型冠状病毒的疑虑。
因为新型冠状病毒感染这个疫情爆发以来，有大量的发热病人涌入到了我们的门诊去就诊，给所有的这个接诊的医生、一线的接诊医生造成了一个很大的工作压力。在这个基础上的话，我们在前天晚上就紧急上线了这个关于疫情的一个免费咨询活动。我们可以除了在网页端进行回复之外，我们还可以用手机端进行回复。所以在我们的吃饭时间或者是休息的时间，我们就带着手机随时在线回复的。晚上的话，我们是6点钟左右就下班，但是我们带着手机端可以随时在家进行回复。然后实际上的话，我们最近几天都是工作到8点9点我们才回去的。然后的话，我们对外是说10点钟就结束了这个夜间10点钟就结束了这个咨询。实际上，只要我们有时间，10点钟之后甚至凌晨，我们都还在用手机端回复。
Zhou Cui-chung is also glad to be of assistance. The pediatric nurse even volunteered to go for emergency training to help handle patients who suffer from the new pneumonia-like virus.
知识培训的很好，我是一个儿科的护士，我前后接受了这种新型肺炎的培训，真的是不下于8次了。就这段时间，从年前到现在，不停的在接受这种培训，这种还有防控措施这些培训的很多次，就医院非常重视这方面，也一再的强调员工要零感染。
China's continual efforts to ramp up treatment and containment measures also included the construction of 2 new hospitals in Wuhan. They were completed in under 2 weeks. Authorities recalled thousands of construction workers during the Chinese New Year holidays, doubled and tripled their salary, and they worked around the clock to build the 2 hospitals which provided 2,500 beds. Still, many challenges remain. At the heart of all containment strategy is the understanding of what doctors call the pyramid.
At the tip of the pyramid, you have the persons who are symptomatic. Then at the bottom of the pyramid, you have people who are, less symptomatic. And then you have the asymptomatic, big, huge chunk at the bottom of the pyramid. So in order to understand how you're going to contain, you need to know the big pyramid. But here, if you focus only on the iceberg at the top, you are going to get hit by what's below.
Medicine has taught us with limited resources, you only treat those who are the sickest. So the sickest will get admitted, and this will be the top of the pyramid. And what we are seeing perhaps are just the top 10-20% of the patients. And for the rest of it, 80%, we are not seeing, we are not treating, we are not quarantining. Instead, we are releasing them back into the public, where they can in turn reinfect others. What we are not seeing will be the greater base at the pyramid, which are easily 40 times more than what we are seeing now. These are the ones where there are active propagation of the virus.
Since the World Health Organization declared the novel coronavirus outbreak as a global emergency, international response has been swift. All flights to and from Wuhan and the larger Hubei province have been banned, and citizens have also been advised against all non-essential travels to China. Scores of nations, including Indonesia, Philippines, Japan, South Korea, New Zealand, France, Turkey, and the US have scrambled to evacuate their citizens from Wuhan city as China struggles to come to grips with the outbreak. Should China be blamed for the latest epidemic? During the 2003 SARS outbreak, the government took some 4 months before announcing to the world about the severity of the crisis. It was then accused of withholding information and covering up. In the current epidemic, it took the government about 1 month to declare after the first case was reported on December 8, 2019. By January 12th, Chinese scientists had already identified the virus as the new coronavirus similar to SARS. It has since shown speed and political resolve to control and contain the outbreak.
The Chinese government has at least tried to restrict inflow and outflow into her province itself. Travel outside China itself has been constrained, which has helped to at least contain the flow of people. They have extended the holiday period for the Chinese New Year as well. So these are measures that are slightly on the brighter side. So there are some positive signs where the Chinese government has done some positive things.
I think we have to go back to the root of the problem, whatever emerging or re-emerging infection it is, and to understand the dynamics and the nature in which it actually crossed over to the human species. Where exactly did we go wrong? Why are we allowing this issue of wildlife and humans to come close to each other? We should abandon that.
And as the novel coronavirus spreads, there's also growing fear that the deadly pathogens or viruses can mutate and spread to become a more effective killing machine.